in Candies Creek Center across from Waggles.
Mix 104.1, well, good morning, and we're always pleased to tell you Mix Mornings is presented by Bradley Medical Center, and speaking of which, we have our friends, the leadership, Bradley Medical Center, and, of course, Vitruvian Health, and I want to say good morning, first of all, to my longtime friend, Stephanie Austin.
Good morning, Steve.
And you've given yourself such a long title, I can't remember it.
I know. Whatever the job requires that day will be my
Well,
job.
remind me, you're vice president of
No, I'm an executive director of marketing.
Executive director.
Yes.
Well, you told me you're CEO. I didn't know. Anyway, executive director.
Sunday, she acts like she is.
Well, I know, Lisa. I know that.
And today she can have it.
We're going to be talking about this, but Stephanie, it's a wonderful time, isn't it?
Yes, it's been exciting. We've just had a lot of great things happening at the hospital, and we just want to thank the community. We're proud to be the community hospital.
And you've brought the CEO. How about this? Why don't you introduce him to everyone?
I'd love to introduce Jeff Myers. He's president and CEO of Vitruvian Healthcare System.
Jeff, welcome. I think it's his first time here. Is that right?
Yeah, it is. And, well, we've been here about a year now, really.
I mean, you
Just
in the
over
studio.
a year.
Here
Oh, in the studio.
Yeah,
Here.
yeah.
Yes, this is day one.
It's been a year, though, Jeff, and I tell you, my goodness, the conversation in this community has been so positive. Why is that? Why do you think things have just gone so well the first year?
Mostly me.
I wondered if the protesters were for you. I didn't know. Anyway.
No, well, Hamilton has been around for about 100 years, and the culture there is just amazing. The boards, it's all about the community. It's all about taking care of people, period, end of statement. You know, we're a nonprofit, and so it is not about this quarter's profits. It's about identifying what the needs of the community are and serving people. And they trusted me to say, yeah, okay, let's come on up here and do the same thing up here. And we're excited about it. We've been able to bring a lot of new things in here. Lisa brought her back here, which is wonderful. And I think we're over $200 million that we put into this community in terms of things we've done. Land acquisitions, all preparing for the future. And so you're going to see a lot coming down the pike in the next few years. We've got a facility master plan, intentions of bringing more physicians to the community and more capabilities, and it's about taking care of people, period, end of statement.
The leadership of our hospital, Bradley Medical Center with Vitruvian Health, Lisa Lovelace is the CEO here locally, and Lisa, good morning.
Good morning. I'm the CEO, unless Stephanie decides she wants to do
Well,
that today.
let me tell you, Stephanie walked in here and she's the CEO of the radio station.
I know.
But
You
she
know,
can
that's-
also
Is that
have
a problem? I didn't know that was an issue.
Hey, next time, will you bring some hospital beds with you? Very nice.
Well, speaking of hospital beds, we did buy quite a few last year to replace all the ones that we had in the building. And, the other things that I'll say that we've focused on this year really have been just connecting with the community. And last night, or yesterday afternoon, we had a Bradley Memorial Hospital reunion in our building. And it was so well attended. It was such a cool event. And I have to give Stephanie and her team credit for that. That was it. It was really good to see that unity back with a lot of the Bradley Memorial Hospital employees. So that was a great thing to do.
Well, there's so much history there. I mean,
Yeah.
and even I think about my own grandmother who worked there for over 40 years. But, you think about the people born there, the people who worked there. I mean, I love that you did that. That's tremendous.
It was a special moment. It was a full circle special moment, and it's great to be able to do that. So we have a lot of good things that are going on. One of the things that will be upcoming is we've started a new orthopedic practice that will be a Bradley Medical Center sponsored practice.
Wow.
Dr. Mike Calfee, who is a Cleveland native, and he played football at Cleveland High School. So he will be joining us in October, I'm sorry. Well, you know what? He's actually starting in September. And then we have, he's a foot and ankle fellowship training specialist, and we have a hand specialist that's starting, Amy Halpern, in the fall as well.
Wow.
And then Dr. Ricky Hutchison and Lee Radford will also be a part of that group. So we're excited
Wow.
to be bringing subspecialties into our community that will allow us to stay here. And we will have ENT back on staff at the hospital, ear, nose, and throat, otolaryngology in the fall too. So there's been a lot of recruiting to try to bring services back into the community that we need.
Why don't you mention all the cardiologists too, in terms of the expansion?
Yeah,
there?
we have
It's been huge.
we have the cardiologists that are here. Have been here for a while, Dr. Abraham, Dr. Austin, Dr. Stewart, and then we have electrophysiology that's here on a part-time basis. We'll be bringing structural heart here, and then we'll be having a clinic for open heart surgery, and then the surgeries will be done in Dalton. So we're doing really a system approach to cardiology in the market that brings us more services into the Cleveland community, and we're very excited about that expansion.
Jeff, this is unbelievable. I mean, all right here in Cleveland.
At the end of the day, we're about bringing things to the community, not taking from the community, and that's what it's really about. So it's about people taking care of people, and
Oh, man.
I love it.
Stephanie, with you and Lisa and your history here locally, this has got to be an exciting time for you personally.
I would say last night was one of those moments because it was full circle for both of us. I think those of us that stayed and we were always about the community, whether the company that owned us at that time was or not. And it was really rewarding to be able to have that full circle moment.
Talk about what Lisa said about orthopedics especially. My goodness.
Well, more to come on that.
Well, here we go.
Yes, no, you'll be seeing more information coming out on that over the next couple of weeks. It's exciting. Again, our whole purpose, as Jeff and Lisa are both saying, is we feel you don't have to go down the road to get care, and we're going to do what we need to do to help make sure you don't have to travel, especially on 75 right now.
Who wants to go to that split?
No, exactly. Exactly.
It's awful.
There are so many things that we're doing, and we'll be talking about the master plan. I mean, we have purchased about 10 acres of property across the street from the hospital that will give us some expansion opportunities. And as we're continuing with that master plan, I would love to come back and share a lot of those ideas with you, and as we are looking at different ways and timelines and that kind of thing.
If you do anything to Joe Moore's building, just please make sure he's inside the building when you do it. That would be a favor to the entire community.
I'll let him know that you requested that.
Well, I'm letting him know. Hey, Janie, tell Joe I said that. Joe does not listen. But when I'm on a treadmill at the Y, he does come up and punch me in the kidney. So, very sweet. Yes. So we know it's been very public about the situation with United Healthcare. Bring us an update, if you will, and tell us what people need to know.
Oh, that's a fun one. Well, I'll give you the gist of it. We did a contract with at Hamilton over a year ago, and they agreed to market-based rates, which were the equivalent of what was around at the time, and that was a contract between United Healthcare of Georgia and Hamilton, because that's the way United Healthcare does things. And it was a corporate contract, so it applied across the board. Unfortunately, the folks in Tennessee don't like that. They like what they have. And so we're in a dispute. And normally these things are handled behind the scenes. You haggle out, you work it through. And we're kind of mystified by some of the things that they've done and how they've gone about it. But at the end of the day, we'll figure it out, and we will. And we made a decision. We're in network, and we're going to treat folks just as though we have been in the past. That's very unusual for an organization like that to do this. But we're about taking care of people. Period. End of statement. And we're in this community. We're here to take care of people, and the fight will go on between us behind the scenes, and we'll get it worked out. But in the meantime, we're not going to have people get hurt. And if that means it costs us some money along the way, that's what it's going to be. But we're here for the community. Period. End of statement.
Go ahead, Jeff. Yeah.
No, that's it.
Lisa, anything you want to add to that?
I mean, I just am grateful to work for an organization like that will support us and allow us to see those patients even though we're going to be holding those claims, not being paid anything until this is resolved at least, and taking that risk because it's the right thing to do for patients. And I think that speaks to our culture and who we are as an organization, which is the message that I hope that the community has heard over the past year, but now you're getting to see that in action.
Yeah, absolutely. Stephanie, it's truly amazing what the hospital is doing.
Again, I can say I've been in quite a few negotiations throughout my career, and this is historical in my opinion. It's always been the patient that's kind of left to figure things out on their own, whereas here we're stepping up, we're giving them options. One thing I do want to make sure is it's very difficult because every plan is different, and so we would just encourage anyone that has questions about it, based on what plans they have, to reach out to us at 423-380-6090. We have financial counselors available to walk through what the different options are. Again, as Jeff said, we're standing by the community in this regard.
Jeff,
I was going to say, for what we're doing, we will do everything we can to protect each person coming through. As Stephanie said, every health plan design is a little bit different, so we need people to help and walk you through it a little bit, but we're going to stand by each person and do everything we can for them, and we are not going to put them at risk.
And that says it all right there about Bradley Medical Center and Vitruvian Health. Again, if you have questions, you can call 423-380-6090. And Lisa, great to see you. Anything you want to add here before we go?
I can't wait until we have our community lighting events only a few months away. We're going to try to make sure that we have lights on the stage this year, though, Steve. I'm just going to say.
There's going to be lights. There will be lights, Lisa.
I understand budgets, and it's okay. We were actually at a rare moment, and Jeff was on stage. Jeff was limping around last year.
Yes.
Knee operation.
And I may be again.
Well, hey, that's fine. You can fake it until you make it. Listen, it was a rare moment of city and county cooperation.
That's right.
When Kevin Brooks held a flashlight for Gary Davis. I mean, that was beautiful. You brought everybody together.
It was providential, Steve. That's my position. It was
Speaking of providential, hello, Pastor Alan Lovelace.
Well,
How's he doing?
He's doing okay.
Making fun of me as usual.
Always making fun of Steve Hartline.
Stephanie, great to see you. Anything you want to add here before we go?
No, again, just reminders, we do want the public to reach out to us with any questions. So that's 423-380-6090. And there's more exciting things to come. We're about to go into tailgating with some of our key schools, and we're going to have window contests for each school. So you'll hear more about that, and we'll need the community to help vote on that.
I hope you'll come back and tell us more. Jeff,
absolutely.
Jeff Myers will give you the final word, the CEO. Anything you want to leave us with?
At the end of the day, we're here for the community. We're here for all the people we're here to serve, period. That's it.
Thank you guys for a wonderful year, and look forward to many, many more. It's been tremendous. Bradley Medical Center with Vitruvian Health. 1 year! And we're so excited about the future. And my goodness, we got